Okay, so I'm going to verify provider's orders, I'm going to verify the care plan, and I'm going to maintain standard precautions throughout. Okay. Knock, knock, knock.
Yes.
Hi, is now a good time?
Yes.
Okay. Open the door, provide patient privacy, hand hygiene. Hello, my name is Nicole Gomez. I'm a student nurse at Nevada State College. Can you please state your full name and date of birth for me?
Bruce Wayne.
And your date of birth? Okay, and matches your wristband. Do you have any allergies?
No.
Okay. May I take a seat?
Yes.
Sure. Okay. So I am here to perform tracheostomy care. I'm going to change your bandages, and I'm also going to suction any excess mucus you have in your chest. Do you have any questions regarding this?
How long will this take?
It won't take too long. It will be fairly quick. I'm just going to be removing the mucus from your chest, and I'm going to provide you with oxygen because it may get a little bit uncomfortable. So I'm going to ensure that you have adequate oxygen during this procedure. Okay, and I'm also going to remove the dressing that you have on right now and do some scrubbing of your inner cannula and put it back in sterilely and put a nice bandage back on to your tracheostomy. Do you have any questions? Any other questions?
No.
Okay. So prior to this, I would have set up my suction canister and my oxygen bag for hyperoxygenation of the patient. Okay, so I'm going to place the patient in a semi-Fowler's position to avoid the patient from aspirating. I'm also going to obtain vital signs. I'm going to check for his pulse oximetry, his respirations, and his heart rate. And I'm going to make sure that the canister is occluded to make sure that the suction is going the right way. And I'm going to make sure that the suction is at a regulated rate between 80 to 120. So I'm going to adjust it now. So now it is at 90, which is at the regulated rate. Okay, so any questions before I prep my equipment?
No.
Okay, so now I'm just going to step aside and prep my equipment. Okay, so I'm going to obtain I have done hand hygiene. I'm going to obtain the suction catheter kit. I'm going to make sure that it's not expired and the integrity is still there. So I'm going to open it up. Okay, this is sterile technique. Okay. Sterile glove technique. At that point, since it's going back, I would have to obtain another set of gloves. Should not go back like that. Okay. Sterile gloves are on. I'm going to label my non-dominant hand as a clean hand and my dominant hand as a sterile hand. Okay. So now I'm going to attach the suction. Okay, now that it is suction, I'm going to check that it's working. Okay. Okay, Mr. Wayne, now I'm going to begin the suctioning. Oh, prior to prior to beginning this, I must hyperoxygenate my patient. Okay? So I'm going to use my clean hand and obtain my oxygen bag, apply it here, and then allow him a couple of breaths. 1, 2. How's that feel, Mr. Wayne?
It's fine.
Now, I can attach it to the suction. I'll be using this hand. Okay, Mr. Wayne. Please let me know if at any time you feel uncomfortable, okay?
Okay.
And then I will stop. Okay. Okay, now I will insert no more than 6. Okay, and then I will spiral out no more than 10 to 12 while opening and closing. How's that feel, Mr. Wayne? Okay, let's get that mucus out one more time. Okay, in no more than 6, and then twirl out no more than 10 to 12. Okay. Are you okay? How's everything feel? Okay. Perfect. Now, at this point, I'm going to remove, at this point, I would obtain his vital signs one more time. I would obtain his heart rate, his respirations, and his pulse oximetry. Okay. Now, I will remove the soiled bandage with my hand so that I can begin my trach care. I will remove my PPE and do hand hygiene. Okay, so now I will obtain a mini tracheostomy cure kit. I will check for integrity. I will check the expiration date. Okay, I have done hand hygiene. Okay, now I will open the bag, the kit. Okay, at this point, these Thera gloves would have been in this kit, so I'm going to open this. Okay. What are you doing, Mr. Wayne? You're okay? Almost done. Check your thumb. Gloves on. That. Okay. These gloves are being temperamental. I would have probably obtained new gloves. Okay, at this point. I'm just going to pull this down. Okay. Now, I'm going to remove all the contents of the bag. Remove this and put the sterile drape down. Okay. Sorry. Should be shiny side down. Okay. So I would remove the contents of the bag. I would have a 3-compartment place here to place the saline water in the 3 compartments. I'm just going to open the saline water now. 1, 2, 3. Okay. All right. Now I need to remove So the left hand is my clean hand, and the right hand, my dominant hand, is my sterile hand. So I would remove it, my clean hand. I would now dip it into the first compartment. I would obtain my wire brush, scrub in and out, and then I would place it into the second compartment to rinse it out. Okay, and let it dry. Okay, at this point, I would now put it back into the patient. Slowly. Is that okay, Mr. Wayne?
Mm-hmm.
Okay. Okay, the sterile technique is now complete. I can now obtain a Q-tip in the third compartment, saline water. I would clean the front of the faceplate. Make sure that's clean. Back in the compartment, I would clean the back of the faceplate. Get any of the oozy bits out of there. Okay. And now I will obtain clean gauze to apply back around. Okay, I will loosen the straps. I will loosen the straps to ensure that the gauze would fit nice and snugly. How's that feel, Mr. Wayne? Okay. Okay, at this point, I would ask the patient, do you need anything else, Mr. Wayne?
No.
Okay. So at this point, I would remove my PPE, hand hygiene. Okay, lower the bed to the lowest position. Put the brake on, put up the handrails, provide the call light. All right, if you don't need anything else, Mr. Wayne, I'm going to be back in about an hour, okay?
Okay.
All right, thank you.
Thank you.